Does radioactive iodine therapy harm other tissues? Imagine a treatment that targets only the thyroid gland, but sometimes affects nearby tissues. That's what happens with radioactive iodine therapy, a common treatment for hyperthyroidism and thyroid cancer. The thyroid is unique because it absorbs iodine naturally, which makes it an ideal target for radioactive iodine. The iodine emits radiation that destroys overactive or cancerous thyroid cells. But even with this targeted approach, some other tissues can be affected. The most common non-thyroid tissue impacted is the salivary glands. These glands also absorb iodine, though to a lesser extent. This can lead to side effects like dry mouth, pain, swelling, or changes in taste. Usually these effects are temporary and resolve on their own, but in some cases, they can become long-lasting, causing persistent dry mouth or recurrent inflammation. Other tissues that might be affected include the bone marrow. Rye can cause a temporary drop in blood cell counts, including red blood cells, white blood cells, and platelets. This effect is generally mild and reversible within a few weeks, especially at lower doses used for hyperthyroidism. However, in higher doses, such as those used for thyroid cancer, the impact on bone marrow can be more noticeable. In rare cases, if rye is used for metastatic thyroid cancer that has spread to the lungs, it can cause lung tissue fibrosis. This scarring can make breathing more difficult over time. Reproductive effects are also possible. Men might experience temporary infertility because sperm cells are sensitive to radiation. Women are usually less affected, but caution is still advised. There is also a small risk of developing secondary cancers many years after treatment. These include salivary gland cancers, leukemia, or other solid tumors. The risk is very low, but it is important to be aware of it and to have regular follow-up with your healthcare provider. Damage to tear ducts and dry eyes have been reported in some cases, but these are rare. Overall, most side effects are mild, temporary, and manageable. Serious long-term complications are uncommon, especially when doses are carefully tailored to each patient. It's important to remember that rye is a well-established treatment supported by medical guidelines. Patients should have thorough discussions with their healthcare team to understand the potential risks and benefits. Monitoring during and after treatment helps catch any side effects early and ensures the safest, most effective care. Always consult a healthcare professional for personalized advice and to address any concerns about rye therapy.